Vaginal health is an essential part of a woman's overall well-being, often quietly maintained through daily routines and habits. Yet, many women unknowingly engage in everyday practices that can disrupt the delicate balance of the vaginal environment. These seemingly harmless habits can lead to discomfort, infections, and other health concerns. Let's take a closer look at 5 everyday habits that may be secretly harming vaginal health and what you can do to protect yourself. The first habit to be mindful of involves personal hygiene routines, specifically the use of scented soaps, body washes, and feminine hygiene products. While these products often promise freshness and cleanliness, they can actually disrupt the vagina's natural pH balance. The vagina is self-cleaning, maintained by beneficial bacteria known as lactobacilli, which keep harmful microbes in check. Scented soaps and washes often contain harsh chemicals and fragrances that can irritate sensitive tissues and strip away these protective bacteria. Over time, this disruption can lead to itching, burning, and a higher risk of infections like bacterial vaginosis or yeast infections. To support vaginal health, choose mild, unscented, and hypoallergenic products for your intimate areas, and remember that plain warm water is often all you need for daily cleansing. The second habit that can inadvertently impact vaginal health is wearing tight, non-breathable clothing for extended periods. Leggings, skinny jeans, and synthetic underwear have become wardrobe staples, but they can trap heat and moisture around the vaginal area. This warm, damp environment creates the perfect breeding ground for yeast and bacteria. Over time, this can increase susceptibility to infections and general discomfort. Cotton underwear and loose-fitting clothing allow the area to breathe and help keep moisture at bay. Consider opting for natural fibers, especially during exercise or hot weather, and try to avoid wearing tight garments for long stretches at a time. A third everyday habit that often goes overlooked is improper wiping technique after using the bathroom. Wiping from back to front can transfer bacteria from the anus toward the vaginal opening, increasing the risk of urinary tract infections and vaginal infections. This is particularly important because the urethra, vagina, and anus are in close proximity, making it easy for harmful bacteria to move between these areas. The best practice is to always wipe from front to back, ensuring that any bacteria are directed away from the vagina and urethra. Teaching and reinforcing this simple habit can make a significant difference in preventing infections. The fourth habit involves the use of panty liners and pads on a daily basis, even when you're not menstruating. While these products can feel like a convenient way to stay dry and fresh, especially for those with vaginal discharge, consistent use can actually create problems. Panty liners, especially those made with synthetic materials and adhesives, can block airflow and trap moisture, much like tight clothing. This can lead to irritation, chafing, and an increased risk of infections. If you prefer to use liners, choose unscented, breathable options and change them frequently. If possible, allow your body to go without them for parts of the day to let the vaginal area breathe. Finally, the fifth habit is neglecting to change out of wet clothes promptly, particularly after swimming or working out. Wet swimsuits and sweaty gym clothes can cling to the body, keeping the vaginal area damp for prolonged periods. As with tight clothing and panty liners, this excess moisture creates an environment where bacteria and yeast thrive. If you're unable to change immediately, try to bring a dry set of clothes for after your workout or swim. Quick action can help keep the area dry and healthy, reducing the risk of irritation and infection. Beyond these 5 habits, it's important to recognize that vaginal health is influenced by a range of factors, including diet, hormonal changes, stress, and even the medications you take. While it's easy to overlook the impact of daily routines, small changes can add up to make a big difference. Cultivating awareness of these habits is the first step toward protecting your intimate health. So, what can you do to safeguard your vaginal well-being? Start by keeping your cleansing routine simple and gentle, avoiding unnecessary fragranced products. Prioritize breathable clothing and natural fabrics, and give your body a chance to air out whenever possible. Practice good hygiene by wiping from front to back and changing out of wet garments as soon as you're able. If you use panty liners, consider taking regular breaks from them and choosing products designed for sensitive skin. It's also helpful to be mindful of other lifestyle choices. A balanced diet rich in probiotics, found in yogurt, kefir, and fermented foods, can help maintain healthy vaginal flora. Staying hydrated supports overall health, including the health of your mucous membranes. Managing stress and getting enough sleep can bolster your immune system, which plays a vital role in warding off infections. Lastly, don't hesitate to consult with a healthcare professional if you notice changes in your vaginal health, such as unusual discharge, persistent itching, or discomfort. Open communication with your doctor can help address concerns early and prevent minor issues from becoming bigger problems. Remember, vaginal health is a normal part of your overall wellness, deserving of attention and care. By becoming aware of these 5 everyday habits and making conscious adjustments, you can better protect your vaginal health and overall comfort. Simple shifts in your routine, like choosing the right products, prioritizing breathable fabrics, and practicing good hygiene, can go a long way in supporting your body's natural balance. Ultimately, a little extra awareness can empower you to take charge of your intimate health, leading to greater confidence and well-being each day.